Welcome to Dr. Linda TV, Best of Health. Today, Dr. Linda talks about how to be a good health detective. Top 12 questions to verify health information.
Hi, I'm pharmacist Dr. Linda Bernstein.
The old saying, you can't believe everything you read, certainly applies to health information. Today's Ask Dr. Linda question is, Dear Dr. Linda, how do I know if health information I receive from the internet and other sources is trustworthy? Signed, JTF, Just the Facts. Dear Just the Facts, I feel your frustration. You're not alone. Every day we're bombarded with health advice from the internet, in magazines, on TV, social media, and elsewhere. It may be in the form of an article, news report, direct product advertisement, or a more subtle, thinly veiled advertorial, which looks like an informative article but is actually a soft product sell. It may come from a testimonial by an influencer, a celebrity, or patient with the same condition as you. You might receive advice from a well-meaning family member or a tip from your next-door neighbor. While some health information resources are current and reliable, others are not. Of course, the best place to get personalized health and medical advice is from your healthcare provider and pharmacist who know you best. That said, many of us turn to other health resources for guidance on everything from drug side effects to common ailments such as high blood pressure or how to get rid of hiccups. We want to be informed consumers. But are there any red flags that might indicate the information should not be trusted? Who do you believe, and how can you be sure it's the best advice for you and your family? You must be a good health information detective to find out the answers. So get out your magnifying glass. Here are some tips on how to verify that the health information you receive is trustworthy. Start by asking yourself, who is the author? This is a key question. It may be hard to tell unless you do some research on who is writing the piece. Check the byline of the author or the About section if it is an organization. Ideally, the author should be a medical professional with the proper expertise and training, free of conflicts of interest in presenting the subject matter. If the author is a journalist, they should draw from and cite the experts and trusted resources used to write their story. They should use several independent sources. If the author is a paid drug company spokesperson or represents an organization that is a drug company-sponsored entity, you run the risk of receiving biased health information. How can you contact them? Contact information for the author or publisher adds additional credibility. Why has the article been written? Is it strictly for news or information purposes? Or is the author trying to sell you on the latest and greatest cure for what ails you? Is the goal to familiarize you with a new drug so you'll then ask your healthcare provider about it in the hope that he or she will prescribe it for you? This kind of indirect sales pitch often lacks full disclosure about the pros and cons of the proposed treatment. Note that in Google search, for example, some links are labeled as, quote, ads, while other websites, it may be less clear to determine if it is a commercial entity or not. Next, is there a quick way to tell what kind of an organization is putting out the information? Usually, website addresses ending in .org are for nonprofits, .edu for universities, and .gov for the federal government. Those are good indicators of non-biased sources. Websites ending in .com or .net are generally companies and more likely to be commercial. There are exceptions, such as WebMD.com or Drugs.com, which are good general health information resources. Is the article written in a fair and balanced way? Are the benefits and risks of using the medicine spelled out? Is there pricing information? Is there mention of less expensive generic products available that work just as well? In pharmaceutical advertising, drug side effects, for example, are often written in tiny print or spoken as fast as humanly possible. There are often beautiful graphics of happy, healthy people presented visually, while a voice reads off a list of life-threatening drug side effects. Are the claims based on a quality clinical study? The gold standard of study designs is the randomized, double-blind controlled trial. That means that patients are assigned at random to receive either the non-active placebo or the potentially active treatment under study. Neither the patient nor the clinician knows who is receiving the study drug, so there is less chance for bias in the results. Once the study is done, the researcher submits the findings to a medical journal. The most respected journals, such as the New England Journal of Medicine or JAMA, the Journal of the American Medical Association, have a scrupulous peer review process where independent expert specialists review the study methods, results, and conclusion. If they deem it to be a quality study, it is finally published. Was the study funded by a drug company? That may indicate the findings have a possible bias in favor of the company's product. Does a report sound too good to be true? Be suspect of claims that sound like miracle or secret cures. A glowing testimony of one user does not necessarily apply to you or prove anything. What is the status of the product described? New drugs and certain biologics must be proven safe and effective to the Food and Drug Administration's satisfaction before companies can market them in interstate commerce. If the FDA grants an approval, it means the agency has determined that the benefits of the product outweigh the known risks for the intended use. Unlike new drugs, dietary supplements carry a disclaimer stating that the claim has not been reviewed by the FDA and that the product is not intended to diagnose, treat, cure, or prevent any disease. When was the article written? Check to see when the information in the article was last updated. Is the article well written? If you notice spelling errors or poor grammar, that's a red flag that the information should not be trusted. Is this the original information source? Often news reports are based upon a press release rather than the original study publication. It might be a sifted together summary from several sources and contain misleading claims or incomplete facts just to attract you to a particular website, a technique known as health news clickbait. Now that you have learned some ways to use your detective skills to screen for poor quality health information, I want to provide you with some useful links to reliable health information resources. Again, this is not to replace the advice you receive from your healthcare provider. Some good websites for health information are offered by medical institutions such as mayoclinic.org, various online Harvard Health publications found at health.harvard.edu, and the University of California, San Francisco at ucsfhealth.org. The government has several websites that provide reliable health information. One such site is medlineplus.gov, powered by the U.S. National Library of Medicine. The site provides descriptions of and current consumer information on hundreds of medical terms and conditions, drugs, herbs, and supplements. You can find helpful videos and health check tools. The Centers for Disease Control and Prevention website at cdc.gov and the FDA's at fda.gov are both excellent websites. Established healthcare organizations such as the American Heart Association at heart.org or American Cancer Society at cancer.org also provide useful, consumer-friendly health information according to their specialties. Long-standing health websites such as Healthline.com, WebMD.com, EverydayHealth.com, and Drugs.com are also useful general resources. The Merck Manual for Consumers is also a good source of health information at merckmanuals.com. Finally, it's important to realize that medical opinions can change as additional research findings become available. Consult your healthcare provider when you have questions about your specific medical condition. Your pharmacist can also help you to interpret what you're reading and better understand claims about medicines and supplements. Go to www.drlinda.tv blog section for an informative article on the subject and a more complete list of good health information resources organized by specialty. Remember, use your best detective skills to weed out the bad and focus on the most reliable sources of high-quality health information for you and your family.
Thank you all for allowing me to help guide you through the complexities of these topics so you achieve the best of health. If you want to learn more, I'd like to hear from you. Please like and subscribe. Leave me a comment or visit drlinda.tv to send a question. Until next time, I'm pharmacist Dr. Linda Bernstein.